Hi everyone, this is Durga Prasad from Dharmavaram, Anantapur district, Andhra Pradesh. I'm a software engineer by profession. On Jan 27th of 2021, I underwent a shoulder surgery performed by Dr. Anjan. The reason was I had a seizure on the previous day and it led to my right shoulder fracture. When I had this seizure, I was at my home and it was a complete blackout. I woke up at my local hospital. Then my right hand started to pain like hell. The pain was really unbearable and it really made me cry. So we got our x-ray done and our local doctor confirmed it's a shoulder fracture and he himself referred Mr. Anjan.
A young 32-year-old male, Durga Prasad, he had one episode of seizures and he had posterior dislocation of shoulder and it was locked. He was referred from another state, Anantapur district. So, and CT scan, everything was done, and there was one attempt to do the close reduction also. The whole of the humeral head was in the locked position, and I did not even attempt for close reduction because any attempt would have caused that head to fracture and caused avascular necrosis. And in an young patient with this scenario, it's very, very difficult to manage. Then I decided to do open reduction. So even after induction of anesthesia, when we opened, there is a huge void in the humeral head. So usually in posterior dislocation shoulder, we do regularly the McLaughlin procedure. But in this, when I opened the joint, even the lesser tubercle was also comminuted and fragmented. Then I decided to put a tricortical graft from the iliac crest. Before placing the graft, I put a metal suture anchor and placed the graft over it, and then closed the subscapularis, okay, and then did a double row repair of subscapularis using a swivel lock. So, and then immobilized the patient for almost 4 weeks, and it was his shoulder was kept in a neutral position in 90 degree of elbow flexion and in a neutral shoulder at neutral position.
So I got the operation the next day, and after operation I could really sleep well. It was a very pleasant night. The doctor explained me the procedure, what he has done to me. I was asked to take a complete rest for 6 weeks, and I had some difficulty sleeping with the band-aid and the L-shaped support which was attached to it so that I cannot move my hand. After that point, I never experienced any severe pain. Our pain was very little actually. 7 weeks later, I guess, sir himself removed all the bandage and he tried to move my hand to an extent, and he suggested very, very simple physio.
After 1 month, then started physiotherapy. So the patient cooperated so well, and even though in spite of having severe pain while moving and all, every week he used to come and visit and did physiotherapy, and now he has achieved complete full range of movement, and the repeated X-ray and MRI shows no AVN, and he is happy with the result. It's not the regularly done McLaughlin procedure. So here I slightly modified, where I put the iliac graft and then I filled the defect and then did a subscapularis repair. So on table, complications even the fracture of the head was expected. I had prepared for even with the Herbert screw and with the plate and all. Luckily I could do with this procedure, and he is doing well.
This is me after 10 months. So now I can rotate my hand both clock and anti-clockwise directions. I can make circular motions. I started to resume my workouts mostly on the lower part of my body, and I can do all my work without anyone help. I am really thankful to my doctor Anjan and Apollo for giving me this opportunity. Thanks everyone.